Malaysian citizens who wish to pursue medical studies at 7 universities in Egypt must meet the minimum entry requirements set by the Malaysian government. Health Director General Tan Sri Dr. Noor Hisham Abdullah said the 407th meeting of the Malaysian Medical Council on June 22 set the minimum qualification requirements of at least matriculation, foundation, pre-university or Sijil Tinggi Persekolahan Malaysia, A-level or other equivalent examinations. Dr. Noor Hisham, who is also MMC President, said that the Council received information regarding the reduction of study period from 6 to 5 years for all 7 Egyptian universities recognized by the MMC, as listed in the second schedule of the Medical Act 1971. He said the meeting also agreed that if the minimum entry requirements are not met, prospective graduates from the universities may face problems in registering with the MMC. Dr. Noor Hisham said MMC would also consider removing the universities from the list of universities recognized in the second schedule of the Medical Act 1971 if the matter continued. In this regard, MMC had asked the cooperation of all parties, especially scholarship or educational assistance providers, to ensure that the conditions are complied with so that any difficulties can be avoided, he said. Meanwhile, in a separate statement, Dr. Noor Hisham said all medical specialist training programs offered in the country by higher education providers had to be registered with the MOHE and go through an accreditation process. The proposal was made in a joint meeting between MMC, Malaysian Qualifications Agency, Ministry of Health and MOHE on June 15, to discuss the implementation of the accreditation process by MQA for medical specialist training programs in the country. The proposal also involves collaborative or twinning programs with international certificate awarding bodies. For parallel pathways, Dr. Noor Hisham said the meeting on June 15 also agreed that the MQA accreditation process was not necessary as they were not training programs offered by the local HEPs and the MOH only provided facilities for candidates in preparation for examinations.